because South African government is constructing a coronavirus testing center in a rural town that will be used to screen and test patients who is present with respiratory problems. The plan is to have around 17 of the units throughout the Western Cape of Province, which have the second highest number of COVID-19 patients. Let's have more of that in this report.
Rural town of Paarl, a COVID-19 triage and testing unit is still under construction and will soon be used to screen and test patients who present with respiratory problems. The plan is to have around 17 of these units throughout the Western Cape province, which has the second highest number of COVID-19 patients in South Africa.
These interventions of having the triage and testing outside, we don't want to mix all the patients. And then you're sitting in there, joining the whole EC. It will mean that we have to now quarantine all the people who have been there. Whereas, at least for a year, you find that those who are infectious, mostly with respiratory problems, we could be able to sift them immediately and test. So that's where we are.
What we will see on this side is anybody who screens positive for COVID. So you've got the respiratory tract infection, either you're coughing, you've got a sore throat, you've got a fever with shortness of breath, anybody. So it's a child, an adult, an old person, anybody who screens positive for COVID, according to the NICD guidelines, will come on this side.
The minister then travelled to the township of Mbukweni in the Cape Winelands, a high-density area, an area which has been identified as an area of concern for the possible spread of community transmission of the novel coronavirus.
We do know that most of the people cannot come quickly to whether to go to their private labs and so forth when they are presenting with any symptoms. So that's why we take services to them.
The health minister admitted that she was concerned about the possibility of an exponential surge in the number of COVID-19 patients, especially with regard to a shortage of protective gear in South African hospitals.
Across South Africa, if we get the worst scenario, there will be a challenge of the protective gear. If we get the worst scenario, as of now, everything is under control.
She urged people throughout her province and her country to observe the rules of South Africa's national lockdown.
But I understand that we are still early in terms of the disease in South Africa, so everyone is terrified that what about me? That's why we urge people, we stay here for you, stay home for us.
Door-to-door COVID-19 screening and testing will continue throughout the next week and beyond.